Bismillahirrahmanirrahim. CEO of Male Group of Hospitals, Ibrahim Abdul Razak Halim, doctors, nurses, healthcare professionals present here today, distinguished guests, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh, and a very good morning. I'm pleased to join you today as we gather to confront a challenge that weighs heavily on our nation and our hearts. The rise of cancer in the Maldives, particularly breast cancer, is a matter that touches every community, every family, and for many of us, it hits even closer to home. This issue is not just medical, it's personal, and it's urgent. Cancer, and breast cancer especially, is not just a statistic or a distant possibility. It's a devastating reality that strikes with little warning and leaves a lasting impact on those it touches. We are here not only to discuss it, but to stand together in the fight for prevention, better treatment, and ultimately a cure. Together, we can turn this tide. Cancer is a relentless adversary. It robs us for our loved ones, tests our spirit, and leaves scars that may never fully heal. Yet, in its shadow, we find stories of unimaginable courage and resilience. I have witnessed the heartbreak of losing loved ones to breast cancer, and I have also seen the incredible strength of those who survived, women who have risen from the battle, embodying the spirit of warriors. They are living testaments to the power of the human spirit. Their stories inspire us to keep pushing forward, no matter how tough the road. But we cannot leave this fight to the brave few. We, as a society, have a collective duty to do more. We must speak louder, act faster, and stand firmer in our resolve to combat breast cancer. That's why today, as we mark Breast Cancer Awareness Month, I am filled with hope that together we will make a difference. I would like to extend my heartfelt gratitude to the remarkable teams at IGMH for organizing this critical event. Your dedication is saving lives. As we confront the disease, it is essential to understand it deeply. Knowledge is power. To defeat any menace, we must first uncover its roots, and that is true for breast cancer. We need to delve into the data, the rates of incidence, the effectiveness of treatments, and the life-saving power of early screening. These are not just numbers. They are the stories of mothers, sisters, daughters, and friends. The truth we face is stark. Breast cancer is on the rise in the Maldives. This is a reality we cannot afford to ignore, and with that truth comes as responsibility. To take immediate and targeted action for early detection and treatment, and to craft policies that will curb its spread. We also know that breast cancer remains the most common cancer among women, and early detection is our best defense. It is the difference between life and death for so many. To the women of the Maldives, young and adult women, for far too long, decisions about our health and our future have been made without our voices at the table. We are still far from achieving true gender equality, but taking care of our families, our communities, and even ourselves have always been the women's responsibility. This is why it is imperative that we take proactive steps to safeguard our health. I cannot stress enough the importance of building breast cancer awareness and increasing accessibility to early detection and treatment facilities in place. We, as women, are faced with numerous societal hurdles, yet we must do our best within our means to make conscious decisions to look after our health and seek out health care available to us. In support of that, I cannot stress enough the importance of building breast cancer awareness and increasing accessibility to early detection and treatment facilities in place. I call on all women, in particular those above 40 years of age, to do a mammogram at the earliest if you have not had done one recently. In between screenings, monthly self examination at home are a proactive step we can individually take for early detection. We now have a diverse range of treatment options available locally, including chemotherapy, targeted therapy, and hormone therapy. I'm pleased to know that chemotherapy is now offered by many hospitals across the country, a milestone for increasing accessibility to treatment across the country. As women who are often the primary caretakers in our families, it's often impossible to take time away from our responsibilities. This is why getting the right treatment and aftercare in the country while being surrounded by family and friends is nothing short of a blessing. We are grateful for it. I would like to take this opportunity to comment and convey my appreciation to the dedicated efforts of IGMH to tackle breast cancer in the Maldives. Right now, IGMH is the only institution in the country that offers 3D mammograms. For many of us who are not able to travel abroad frequently, this provides considerable ease to do regular checkups. Research shows that healthy lifestyle choices play a significant role in the prevention and cure of breast cancer. While contracting cancer despite our lifestyle is possible for genetic factors and involuntary environmental exposure to chemicals and radiation play a role, staying active, a nutritious diet, abstaining from tobacco, smoking, and other substance abuse are some of the things we do have control over. Adopting such habits when we are young and well may be effective preventative measures. The Maldives has made remarkable strides in the health sector over the recent decades. The country has achieved remarkable success and has met several sustainable development goals. Additionally, the Maldives has seen substantial improvements in life expectancy. Providing access to quality health care remains a high priority of the government. The Maldives is committed to enhancing public health and ensuring a resilient, responsive healthcare system. Addressing cancer requires a comprehensive and multifaceted approach. The government, collaboration with various stakeholders, has implemented several policies and initiatives to combat this disease effectively, including through initiatives such as the National Cancer Control Plan 2022 to 2026, developed in collaboration with the World Health Organization. The government is also committed to establishing a state-of-the-art cancer hospital to alleviate the suffering of cancer patients. Just this week, the government has announced stringent measures towards banning vaping and tobacco consumption. These measures are necessary, and I hope that the public can support these endeavors for the future of our nation. Breast cancer is no doubt a brutal challenge. The ones it took are not by any measures any weaker than those fought it. Even today, breast cancer remains a sensitive and often stigmatized topic in the Maldives, reflecting broader cultural taboos around discussing women's health issues. Many women face significant social pressures and fear of judgment, which can lead to delays in seeking medical help and support. This stigma is compounded by concerns about marriage prospects and fertility, which are often questioned when a woman is diagnosed with long-term illness. I commend efforts by organizations such as the Cancer Society of Maldives, which are working to break down these barriers and offer evidence-based information. I call on our society, all women and men, to never hesitate to talk about health issues, as it can be a matter of life or death of our mothers, wives, sisters, or our children. Prevention may not be in our hands, but advocacy and awareness and taking proactive measure is. Let us work together as families, societies to tackle the issue of all cancers, especially breast cancer. Let us, as a society, give our endless love and support to breast cancer patients. The moral support that we can offer will have a strong impact on the mental health and well-being of cancer patients. Let us do all that we can. Do help them fight the fight. Let us take a moment to remember the mothers, sisters, friends that we lost to breast cancer and cherish the journeys of those that survived. I thank you all.